Sex is a good thing. It feels good and it's necessary for reproduction. In fact, medical researchers tell us it's a very good thing. Adam and Eve, eating from the apple, it's all part of it. But at one point, sex is a bad thing. And when does that happen? Today, we're going to be speaking to Dr. Robert Hamm. He's a psychologist in West Hartford Center with years of experience in family therapy and this particular issue. I'm Pat Kazakoff. You're watching Psychological Insights. Stay with me, and we're going to meet Dr. Robert Hamm. Hello, Dr. Hamm.
Hi.
So this is a complicated topic, and it makes people a little bit embarrassed. It makes people ill at ease. What exactly, when you talk about sex, what exactly is that? You recalled President Clinton. You recall the famous line, "I never had sex with that woman."
Right. Yeah.
So what exactly is having sex? How do you define it?
Sex is healthy, of course, and it is, as you said, it's necessary for reproduction and evolution. It's just a part of life. And to some degree in our society, I mean, that is a new concept, I mean, because of this sort of our puritanical tradition here in the United States. But I think most people would agree that by and large it's a good thing. However, it can be problematic. It's very complicated. A lot of attention is given to sex in the world that we live in, naturally, because it's so vital to life itself.
But what makes it a good thing? Like, why is it good?
Medical research shows its health benefits. It's good for your cardiovascular system. It's like a form of exercise, if you will. So from a medical standpoint, it has salubrious effects. Mental health-wise, I think it's very important in terms of our emotional well-being. When we're in a good relationship, sex can be a part of that relationship that enhances the emotional bond between partners.
But how do you define sex? Like, is sex men calling women? Is sex men texting women outside of their marriage? What exactly is this thing we call sex?
Oh, well, it could be any of that. I mean, it's in the animal kingdom, it includes rivalry for a mate and all the struggles about that, and courting rituals, which can be quite elaborate. And humans are not much different in that respect. So, yeah, beyond the physical act itself, yes, it's about the emotional connection. It's about all the activities and the grooming and preparations and thought, and it manifests in our culture in terms of literature and drama and comedy and humor, et cetera, et cetera, et cetera.
So you would call sex anything that leads up to the physical act, the grooming, the giggling, the getting ready. That would be in the body of sex. It's not just the physical act.
You could broadly define it as that. It's part of our sexual world that we live in. It's part of the process that leads to the act itself. Yeah, broadly defined. Yeah, you could define it as such.
Do you define it as such?
Yeah, I'm fine with that. With regard to problems in our our sexual lives. It can take many different forms that fall short of actual sex. Whether it's pornography or just an obsession, going into chat rooms on the internet, flirting, emotional affairs. So yeah, it can take on broader ramifications than the actual act itself. Yeah.
So when is it a bad thing? When is sex a bad thing?
Well, because sex is so important to us, I think that it causes us to examine, it's, are there times when maybe it's not good? Such food, for example, is something that we find inherently pleasurable ordinarily, and it's necessary for life, but it's not always a good thing. We can eat bad foods, we can eat too much food. Or the same thing would apply to sex. For example, in the field of psychiatry, mental health practitioners traditionally have made distinctions between what is considered to be healthy forms of sexual behavior and perversions. There's a term for that psychiatry proper uses for that. It's called paraphilias. And there's a whole list of them, and these are the kinds of sexual behaviors that are considered to be abnormal, unhealthy in to some degree or some respect or another. Now, that said, these categories, these distinctions, they're not always universally agreed upon.
Is it a cultural thing also a little bit?
It is. I mean, for example, it wasn't that long ago when being gay was considered to be a mental health problem. And then in 1973, the American Psychiatric Association eliminated that as one of the categories of mental disorders. So the distinction between what is healthy and what's not, to some degree, is culturally determined and by the times that we live in.
But at one point you said, you made the analogy between eating too much food, bad food, and you get fat, you get diabetes. But what is considered too much sex? Like, how do you know it's too much?
Right. Well, good question. So sexual addiction or too much sex, excessive, that also is a distinction by which we can judge whether sex is healthy or not, just as a food addiction or alcohol addiction. So I think in order to answer your question, Pat, first we need to look at what do we consider, how do we define an addiction?
So how do we define an addiction?
People define addictions, and I've been working with addictions for many years, in different ways. So what I find useful for myself, I'm a pragmatist. I would consider myself to be a pragmatist. I take a pragmatic viewpoint of what an addiction is. And what I mean by that is that I judge a behavior as being addictive if it results in some kind of harm or deleterious effect on that person's life in one way or another.
So does the person know that? Most people, I'm thinking of alcohol addiction, most people are in denial about alcohol addiction. In sex addiction, do they know? Do they come to you and say, I have a sex addiction?
In answer to your first question, no, they don't. I mean, it is like an alcohol addiction in that respect, or in different ways, and that's one of them. People who have addictions often are in denial. They're just simply not aware that the behavior is destructive or excessive in some way or another.
So how do they find out? Who sends them to you?
Right. So they often the effects of the addiction results in some kind of ramifications in their lives, where they find themselves in trouble in one way or another. They find themselves ruining their lives. Their partners become savvy to sort of surreptitious kinds of behaviors that they're engaging in that they're not sharing with their partner. So often, it reaches a tipping point where they cannot, such as an alcoholic who might, be arrested with a DUI, or that some kind of behavior that becomes abusive or destructive in some way. It often comes to light when its effects are such that the person can no longer avoid coming to the realization.
And so this deleterious effect, something happens, but it can go on for years.
Oh yeah, sure.
Sure.
So often a sexual addiction is something that's done in private, or it's not something that has a deleterious effect immediately. It's insidious, just as an alcohol addiction or a food addiction might be. But I do want to get back to and answer your question about what is an addiction. It is, in my definition, something that eventually has some kind of harmful effect on a person's life. But it also, as all addictions, it's any kind of behavior that's excessive, where there's a significant investment in time, whether it's involved on the internet, in chat rooms, visiting prostitutes or massage parlors, or on pornography, or engaging in illicit affairs with various partners. That, and then secondly, the individual who comes to an awareness of its excessive use has difficulty in reining that in, has difficulty in restricting or diminishing the frequency of the behaviors that they're engaging
So
in.
why does a person have that addiction? Like, where is it coming from?
Good question. It's really not a simple thing. So there can be many sources. Some people engage in excessive sexual behavior, partly, I think, because it's so accessible on the internet today. It created another world. So the internet is a double-edged sword. We have social media that brings people together that might not have had contact with one another. We have so much information at our fingertips. But also is a gateway to misbehavior. And so if there are any difficulties with controlling our impulses in any way, if there are difficulties in our lives that we have difficulty in meeting or addressing properly, then addictions can ensue.
Is it based on like your upbringing? Like, are you trying to solve some sort of problem? Is it something like you want to be loved? Like, where is it coming from?
Yeah, as I say, there are many different sources. So one of them is the prevalence of the accessibility on the internet. But there's a person there that's engaging. It's not just the computer. It's the person there who's engaging in the behavior, of course. So it can come from a person who is very isolated and has social anxiety, so they're very lonely. Sex can become a substitute for engaging in healthy relationships. Or if you're in a relationship and it's troubled or it's not going well, sex can be a way of avoiding dealing with the problems in the relationship, whether it's on the internet or engaging in illicit affairs, or excessive masturbation or pornography. Sometimes people with personality disorders have difficulty in making good judgments with respect to decisions they make in their lives and their relationships. Excessive sex can be an outlet for a person who has difficulty managing their anger or their frustrations properly. And sometimes a sexual addiction is an outgrowth of exposure in early life, premature exposure to sex, especially if there's been sexual abuse or sexual molestation in childhood.
What about people who ostensibly their life is perfect in every other facet of their life? They're successful professionally, they have beautiful families, they have a great life with their wives, with their children, and they have this dirty little secret. Where does that come from?
Again, it can come from many different sources. Yeah, if a person has been abused, let's say, in childhood, and there's excessive need for sex
But we're defining sex as not just the physical act. We're defining sex as everything that's built around it to get to the physical act. Am I correct?
It could be. So it can be a way of, even if you're, ostensibly living a healthy, normal life, if a person's needs are not met, either sexually or in terms of their sense of self, they may engage in illicit, secretive behaviors, such as needing that ego gratification, that a person with a narcissistic disorder, let's say, it may find that even if they're in a healthy relationship, that they need more to feed their egos to make them feel adequate about themselves.
So there's a neediness about this.
Yes, I mean, deep, I mean, this is not something that necessarily they're aware of, but it's something in the subconscious that can drive a sexual behavior. Or a desire for some kind of physical attachment that is missing early in life if a person hasn't had adequate emotional bonding in their lives.
So how do you cure that? Because you can't cure where it came from if they didn't have sufficient emotional bonding. How do you cure that? What do? They come, they talk to you. Is that good enough?
Sometimes it isn't. It really depends on the individual. So some individuals who engage in who have sexual addictions engage in illegal behaviors that gets them into the trouble with the law. And so in those instances, sometimes there may be behaviors that put others at risk of harm, and they might be arrested. And so part of the treatment would be they might be referred for counseling or a sexual offender or addiction program. So they need to learn not only how to manage their addictions, but also learn empathy and the effects of their behaviors on others.
And so how do they learn that? Just like, is there a 2-step program or a 5-step program? Like, what do you do in counseling to teach them?
Well, I don't work with sexual offenders per se, but that would incorporate a psychotherapy, one-on-one, group therapy, and often a 12-step program. So 12-step programs or support groups can be helpful for individuals, whether you're a sexual offender or not. Helps people, gives them a place where they can share their experiences with others, and gives them a program to learn how to manage their lives and their addictions in a healthier way. When I work with a patient with a sexual addiction, I work at different levels. One is in a behavioral level in terms of helping them to identify the triggers, whether it's an emotional state or a situation or people in their lives. And when we identify those triggers, to help them to be able to develop coping skills so that they don't engage in the same behaviors that are addictive in nature or get them into trouble in their lives. Stimulus control, which is helping them to avoid, again, computers are often a culprit in people's lives with regard to addictions. So we help them manage the electronic devices, whether it's cell phones or computers, either by limiting their access or situations where they can use them, or if they have a partner, the partner takes control in some instances. So that's the behavioral therapy. Now that's often not enough in and of itself. Often psychotherapy is necessary to help them examine what it is that's causing the addiction in the first place.
So let's say, like you mentioned, that they didn't have emotional bonding when they were young. Well, they're not going to get emotional bonding 40 years later or 50 years later. That's never going to happen. So what are they supposed to do with that lack? Like, nobody can fill that void, because that void had to be filled when you were young.
Well, everybody is different. So even if someone has not been able to satisfactorily develop a bond late in life, it doesn't mean that they don't have the capacity to. So I certainly would want to explore that with, if that's something that they wish to do.
How do you build capacity?
Well, you help them to access their capabilities of doing that. The capacity is within the individual themselves. It's whether or not that's something they wish to do in their lives. If they want to be able to be closer to other people or have more friends, let's say, then we would work on the issues that prevent them from doing so, whether it be social anxiety, low self-esteem, or some kind of personality disorder that creates difficulties, turmoil in their relationships. Some people are already in partnerships and relationships, and they're doing these things surreptitiously, and we help them to work with their partners to develop transparency, honesty in the relationship, and develop intimacy skills. But it's not just in developing relationships and friendships. Some people just do engage in sexual addictions because they don't have fulfilling lives, generally speaking. So it serves as a substitute for a healthier way of directing your life in your career or in your hobbies or in social life. So we look at that, the patient and I, in psychotherapy, and looking at how they live their lives, perhaps establishing a schedule in their lives where they can create some discipline and direction that serves as a substitute for the addictive behavior that's developed.
So what would be a substitute for that addictive behavior?
It could be anything that that they wish to, to engage in their lives that would bring fulfillment and interest and joy.
How successful is this kind of therapy? Because I know with alcoholism, it's a very long road.
It really depends on the individual, their motivation to participate, what their resources are. So if it's someone who has a good family background and they're in a good relationship otherwise, they're relatively intelligent and they have a good job, for example, then that increases the likelihood that things that they can benefit from therapy. If they don't have those things, we look into how they can bring those things into their lives. Let's say if they don't have a good support system, how to connect with other people. And so 12-step programs often are a good resource for people who are not well connected and don't have others to relate to when they feel that they're in trouble or they're inclined to relapse.
Yeah, I find this very interesting.
Yeah. Yeah.
Is there anything else you want to tell me that's an important point in this sexual addiction issue?
Well, with respect to how do we define addictions, as I was saying, I define it in a pragmatic sense in terms of what harm, does it bring harm to a person's life? Everybody has their own sort of optimal level of functioning. Some people are very sexual, some people are not. And some people are much more interested in casual relationships than intimate relationships. And to me, that is acceptable. It's really ultimately what eventuates in how one's relationship to sexuality affects their lives in general.
And defining sexuality as everything around the actual physical act.
Right, and the harmful effects also can have many different manifestations. Um, for example, too much time spent. If you're engaging in sexual behavior either by dating multiple partners for the purpose of having sex and it's taking up so much time, or you're watching pornography, whatever it may engage in, if it's excessive, it takes away from other aspects of your life, then we might deem that as being harmful in nature. Or if it's very expensive, or it results in risks to your health, or
Risk to your family.
exposing others to communicable diseases, for example, or yourself, or risk of being arrested, exposure to the family. If it's something that's done illicitly in private and your partner doesn't know about it, it's a violation of trust. Some partners regard pornography as a form of infidelity. So its harmful effects can manifest in so many different ways.
Right. I'm more interested in how you solve this problem. And I'm seeing that it's not easy to solve because it's coming from somewhere. It's coming from somewhere. Mm-hmm. And you can't solve where it's coming from because it already came. So that's,
You mean in terms of someone's past?
Yes.
Right. Well, the way to address a sexual addiction, like many of the problems that I treat in my practice, is I look at what are the symptoms directly, what specifically symptoms are they having, and how is that affecting them. And so I address the problem, first of all, behaviorally, as I said, by looking at the triggers, developing coping skills, using stimulus control to help them avoid those situations that put them in those situations that are problematic. And secondly, then I look at the deeper, what you're referring to, the deeper causes, whether it's isolation in their lives or difficulties in establishing intimacy, difficulties with frustration tolerance, anger, anxiety, social anxiety, problems in their intimate relationships, whether it's a marriage or partnership of one sort or another, or more deeper problems, let's say a loss. Someone has suffered a loss of a spouse, and in order to assuage the emotional pain of that, engage in a sexual addiction, or if they've been sexually abused. So that requires a deeper kind of psychological intervention in psychotherapy.
It's exhausting. I'm listening to you and I'm thinking, this is exhausting. How's this ever going to come? How's this ever going to get solved? But thank you, Dr. Hamm.
Okay, sure.
It's been a pleasure speaking to you. We're talking to Dr. Robert Hamm. He's a psychologist in West Hartford Center. His address is at the bottom of his telephone, and contact information are at the bottom of this screen. And I'm sure you see a lot of different things, and this is probably this is a big one.
Yeah, it is, and it's a very interesting field, and it's a challenge, but I find that it's very rewarding in working with patients with sexual addictions and in general. So I guess you, in describing it, is kind of exhausting, but it's a very rewarding endeavor.
Good. Thank you very much, Dr. Hamm.
Thank you.